my name is Michaela Vermeulen, and I wrote my research paper on prevention and treatment of multiple different knee injuries. Now, to start off, we're going to talk about what is the knee and what does it do for your body. Your knee is actually a joint that is located between your two largest bones in your body, which is actually your femur and your tibia. Now, your knee is very important to your body. It carries a lot of the weight, it helps you through your movements of your leg, and there is multiple things that can happen to the knee. Your knee is actually very vulnerable to stress due to the fact that it is your shock absorber pretty much in your legs, and it has a lot of stress that's going to be caused to it. Your knee is also very, very, very little with its rotation that it can do. Stepping any which way, any which wrong way can cause your knee to sometimes even have meniscus tears or an ACL tear as well. Just knowing your body and knowing everything is really important. Common knee injuries that we have in our bodies are due to the fact of us not knowing exactly how we're stepping, how we're moving through our movements properly. Your knee is actually one of the most helpful parts of your body. It helps you to move, and as dancers, we use our legs pretty much to do everything that we can think of. So our knees are very, very helpful to us in doing our movements, and there's many multiple different kinds of injuries. Some that we see today are knee alignment injuries, injuries to the genu vacuum, and also patella dislocation. Knee ligament injuries. Your knee ligament is what helps you to have stability in your body, just in general. And there are two different categories in having the knee ligament injuries. The first one will be your medial collateral injuries, and then the second one is going to be your anterior cruciate injuries. Now, to start off, we're going to first talk about the medial collateral injuries. Medial collateral injuries is when you have like an accidental force happening onto your knee, which will cause a lot of pain, a lot of tenderness. Your knee could swell up, and you really want to take a lot of good care in those type of injuries. It could just mean that you're simply going to have to be on crutches if it means that you have done something to strain it even worse. But just taking that care and staying in parallel, not turning out too much with that rotation, taking pliés deeper, just really working through your motions and not completely turning out too much and straining that knee. Anterior cruciate ligament injuries. They are very common in dancers, but it is known to be very common in female dancers. Now, this is due to that us as female dancers, we don't have the same amount of strength in our quadriceps as male dancers. And we also don't have the same size of a femoral notch, which is very helpful to your knee. Most likely, when you have this injury, you're going to be hearing a popping noise in your knee. So to take good treatments for this type of injury, you should really think about taking the method called the Rice method. Now, the Rice method is actually when you're resting, you're going to be icing it, compressing it, as well as keeping it elevated every day that you can. Another way to seek some treatment for these injuries is going and seeing your practitioner and seeing if you need surgeries. Now we're going to move on to the genu vacuum, and it is actually also known as, which is simply known as, a knee hyperextension. Now, not knowing your knee well enough and not being very familiar with your body and how it works in dancing, it's going to be very hard to understand how far you can keep that hyperextension if you do have that hyperextension, and how to make it work for your body. That way you're not locking back into that knee, causing a lot of strain, a lot of stress into that knee, which can cause you to have a lot of injuries. Now, when you're hurt in this, it is actually recommended that you you go see a practitioner just in case that there is those different injuries that can be caused from this. Now we're going to talk about the patellar dislocation. Now, when your patella is dislocated, it can actually pop back in. And now, when it pops back in, it is actually called patella subluxation. Now, patella dislocation is where your patella doesn't go back in at all. Now, this is not very good for dancers at all because, like I said earlier, we use our legs a lot in dance. Now, this is mainly caused in dance from doing jumps, such as like grand jetés, just regular jetés, any jumps like from first. A lot of people, if you don't know exactly how your body is going to be working, you're going to kind of cause some injuries and cause some pains. Going through, it's also important that you go see your practitioner and your doctor. Make sure that for these types of injuries, when you do feel these injuries, that you go and take x-rays. You possibly could need to take some MRIs. In this, treatment is going to be very well. Whether it is something simple to something as important as you are going to need surgeries, just knowing the treatment for it and going and seeing a physical therapist is something very important for you to work through your body so that you can become a great dancer again and get back into dancing. Now, prevention to knee injuries. Knowing your body alignment is one of the most important things you can do, as well as proper pliés. Now, in my research paper, I really liked a quote that I used, and it says, "The knee flexor muscles initiate the flexion concentrically, and the quadricep femoris resists eccentrically, contracting against the flexion. Both muscle groups originate on the pelvis, whose centered position is prerequisite for coordination plie." Now, when you take your pliés, you really want to make sure that you're keeping your knee aligned right over the middle of your feet, making sure that you're not buckling over and making sure that you're not pushing too far back with that rotation. Also, knowing your hyperextension in your knee, also known as stretched knee, it's very important that you know that and how your body works. Importantly, that way you don't have to put that strain on your knees and you'll do well. Overloading. So overloading and too much pressure is also known whenever we're going around. As dancers, whenever we have to perform, sometimes we don't know what we're going to get into. Sometimes we don't know if we're going to be performing on a carpet, if we're going to be performing on concrete. And so just knowing exactly how to prevent those measures from happening and warming up your body and not putting too much pressure on your body whenever you're in those different types of environment is very important. Dancers, like athletes, we put a lot of strain and more than a normal person. We just have a lot of strain and a lot of stuff happening to our knees because we use it a lot more than the regular normal people that just are going to classes and not too much of physical activity on their knees. It is important to build your leg muscles. Now, building your leg muscles, such as your quadriceps, is very important as a dancer. It's going to just take a lot of that stress and that strain off of your quadriceps, causing your knee to feel a lot better. That way your knee is not having to work as hard, and that way it can help all that stress be alleviated and everything. Now, it is very important to take the right steps of knowing the right technique, just knowing everything on how to prevent those different things from happening. Now, lastly, I wanted to leave us with a little note saying the next time you have injuries and pain in your knee, it is very important just to get to know your body, get to know those different areas of your knee, get to know how your body works and in different climates and different ways that your body works. Now, thank you so much, and I hope that you have a wonderful day, and thank you for listening to my presentation.